Greetings, everybody. This is my second video, a follow-up to my first video for ulnar transposition with submuscular Z-plasty. Today I'm 1 week post-op. Yesterday I got my cast removed from my doctor at Johns Hopkins, Dr. Dune. For anybody out there who's looking for a great microvascular hand surgeon who deals with these types of issues. His name is Dr. Dune. It's D-U-E-N-E at Johns Hopkins. And just want to follow up and give everybody an update where I'm at. Currently 1 week. As you can see, this is the incision with a small slight hole right here, which is from a drainage tube. Not all surgeons do them, but the really good ones tend to do these types of tubes afterwards. And as you can see, the incision runs from below the elbow, above the elbow, about a total of maybe 6 inches or so. Steri strips are still on there. It's put back together with glue. Really good surgeons tend to do this, and typically your plastic surgeons. Some people tend to have staples. Doesn't do well for scarring. And some people tend to have actual stitching done along there. And to give you a little update what the hand feels like, the feeling back in my hand has slowly come back. The elbow currently, as you can see right here, is still numb in this area, which is typical post-op from this type of surgery, as well as pretty tender through here. My range of motion has not really been existent. It's slowly moving. I can't get out currently to a straight position, which after being a week in a cast, that's probably typical. My motion is about 90, maybe a little bit more, as you can see, and this becomes pretty tight once you start to get the arm back this way. And I discussed with the doctor what was the cause or what was going on with my nerve, since I had had a previous endoscopic small incision tube cubital tunnel release. He said that my nerve was now sublexing and it was slightly bending or coming over the medial epicondyle during flexion. So he said that was an issue, as well as scar tissue that had built up from that previous surgery, as well as a slight compression point farther up, which I believe was the arcade struthers, which is typically a place surgeons do miss, or the ones that tend to not do a thorough job. So that was good to hear. So he said those 3 points are definitely what were causing a problem. As you can see from left to right, I've lost a little bit of my forearm here from where they do the lengthening. That's typical as they create a Z in your muscle, and it basically lengthens your muscle a little bit. So that's something I'm going to have to work on. Post-op care, I am to wash the hand in soap and water, not to drench it in the shower, as well as to clean it periodically for the next 2 or 3 weeks. Weight bearing, I'm not supposed to bear anything in your hand more than 5 pounds for about a month. These are typical protocols for this. Every doctor is a little bit different. So if you have questions, caution with error. Less is best for the most part. And so far I'm pretty positively encouraging from the surgery. It's quite painful, but within a week or two from your surgery, you should start to feel the positive results from it, especially if you have numbing, tingling sensation, or anything like that. Any notes to add to that? I'll be having my right arm done probably within the next 2 months. So I'll have to do it all over again with a cast. As well as right now I have to wear a sling for another week or two while I'm outside. Anything inside, if you feel uncomfortable and feel that you might be put in a compromised position, just wear a sling. But just remember to continue to have your arm out and flexing on and off, so you don't create scar adhesions or any sort of adhesions adhere to your nerve after this surgery, which a lot of people typically have problems with, since they do not continue to follow the typical protocol. In my case, I've done physical therapy enough times to kind of follow my own set of guidelines. If you've never been through physical therapy, you should definitely probably find an occupational therapist who has good experience in these types of recoveries. And that's about it. Other than that, a little bit of numbness left in the elbow, pain and discomfort, some swelling, some drainage may occur. And as far as that goes, that's pretty much all she wrote in terms of the surgery. Not an easy recovery, it's a slow recovery. You're probably looking at about 3 months for muscle strength to kind of regain. You could take anywhere from a year to 2 years, depending on the severity of nerve damage. In my case, the nerve looked good, it was just very irritated. And when you do a lot of flexion, the nerve popping over the medial epicondyle definitely caused some problems. So in my case, I'm hopefully looking for a good to excellent recovery. Like I said, if you have questions, concerns, please feel free to ask. And if you're having this problem, don't wait for an extended period of time to get looked at. Go talk to your primary care physician, let them run a couple simple tests that they do with you in the office. I'm not sure of the names off the top of my head specifically. I think one's a Tinel's test, it's Tinels, where they flex your elbow and they tap here. And if you get pins and shooting sensations up here, it's usually a positive sign for cubital tunnel syndrome. See your primary care physician, get a referral, see your neurologist, get an NCV and an MG test, and go from there. These videos are just to be used for personal experience and not for medical advice. Take everything you hear or read or see on the internet with a grain of salt. Don't continue to read into everything that you see on the internet. I'm not giving medical advice. I'm just giving you a personal experience as what I've gone through, of what you might expect. Everybody recovers at a different rate. Everybody's different. Your metabolism, your body, and the way that you heal is completely different. You do find that you want to eat very healthy after having a surgery like this. That's typical of any surgery. Protein, protein, protein. Stay away from carbonated drinks, sugars. Eat healthy, bananas, fruits, vegetables. These types of things really kickstart your your immune system and the ability for you to heal. So if you can eat really healthy after this, drinks lots of water, stay hydrated, follow the script that you get for occupational therapy, and you should have a pretty good outcome. So hopefully in the coming month or so or two, I'll give another update. As soon as I get this cleaned up a little bit, I'll give you an idea of what it looks like then. And as far as that goes, at that point, I'll probably start using Circa gel within the next 2 weeks. It is a sheet of gel that you can get for scar flattening, as well as keeping the scar from looking unsightly. A lot of people tend to get keloids, where scar tissue fibers start to overlap, and you can get bumpy type scars where it itches. So you can find these products online, Amazon, Walgreens, CVS, as well as Mederma is another one, or cocoa butter. You don't want to use these until your incision is completely healed and the scab has gone away. And at that point in time, you can start using it and rubbing it into the scar, back and forth, across, up and down, side to side, maybe 2 or 3 times a day, 5 minutes. And some people tend to buy handheld massagers to basically massage the scar to flatten it out. That's also another good thing to do if you're concerned, or you're an individual who scars very bad. Not everybody does. A lot of it's genetic based. So, all right, good luck. If you have any questions, let me know.